Hi, I'm making this recording to tell you about a very exciting new seminar. This seminar will take place in London. It's a seminar I've done for my school in Iceland, and it's part of a two-part seminar on rheumatology. And in this part of the seminar, we're looking at the autoimmune diseases. Clinical rheumatology became such a huge subject that I had to separate it into two separate seminars. And in this one, we're only dealing with autoimmune diseases. It's a subject I find fascinating. Firstly, because there are so many of them. So the interesting thing is, we still don't quite understand what these diseases are about. And this seminar is demystifying precisely this. In the seminar, we're going to be asking certain questions. Questions such as, who gets an autoimmune disease? What is an autoimmune disease? Why does the body start to attack itself? Is there a reason for this? It doesn't seem to make sense. If there is a mechanism, how do we turn it off? As practitioners, we also want to not just treat the signs and symptoms, which is really great because we're relieving suffering, but then are we really curing the patient, or are we just managing the signs and symptoms? So we need to see what triggers it, what triggers off autoimmune diseases, what sort of people are susceptible to these diseases, and when we're looking at the whole body-mind connection, because we know as practitioners that it's not just the physical body that's involved, when there's a chronic disease, the mind is also involved. And when we're treating any chronic disease, we need to look at both. So you can look at these things, whether it's an arthritis or a cancer or a skin disease or an asthma, or it doesn't matter what it is. There is some sort of emotional conflict behind the problem. And what we need to find out is, what is that emotional conflict? And is there a pattern? In this first seminar on autoimmune diseases, we're going to be looking at certain specific diseases in depth. We're going to be looking at the pathology, we're going to be understanding the signs and symptoms of the disease, we're going to be looking at the mechanism behind them, we're going to look at the emotional issues behind them. The best way really for me to show you this is via cases, because cases bring everything to life. So one of the illnesses I'm really looking at in great depth is a disease very close to my heart. It's called rheumatoid arthritis. So we're going to look at who gets it, what is the issue, what are the signs and symptoms, what's the medical treatment that's given for it, what's the side effects of the medical treatment that's given for it. In many of these diseases, we often find, and this is what I'm seeing, is that the treatment is often worse than the disease. So we're going to look in great depth at rheumatoid arthritis, looking at a case study to illustrate the example. Another disease I'm interested to show you is called ankylosing spondylitis. Many of you might think this is not very common. Actually, it's more common than you think. Another one close to my heart is fibromyalgia. It's typically actually not an autoimmune disease, but it kind of goes in rheumatology. I'm throwing in fibromyalgia because many people have signs and symptoms of muscular pain. Another autoimmune disease is lupus. So we're going to be looking at all of these diseases. We're going to be looking at case examples. We're going to be looking at a process that is common to all of these diseases and many others, and that is a process called inflammation. And what we need to understand is, why do people get inflammation? Is it something bad? What is it trying to do? What's the whole purpose of inflammation? And what kind of remedies can we use for this? And is there also a spiritual aspect to this? We're also going to be looking at things like streptococcus, the bacteria, and we're going to be looking at a disease I call leaky gut, because this is something that many people have in common, and especially within the autoimmune diseases. And what I give you in my seminars are 26 years of clinical experience. It's going to be very exciting. As all my seminars, they're always done as PowerPoint presentations, so thank God you don't have to sit there looking at me. It makes it more exciting, and I feel it makes it also a lot more visual, because a picture is really worth more than 1,000 words. So I hope that you can join me. This seminar will take place in London, in Islington, 6 Market Road. Looking forward to seeing you then.